Healthcare system right here in California. Huge idea. It's actually the one step closer to making it to the governor's desk.
Yeah, it would guarantee coverage for everyone in California under the same health insurer. The state, you'd have to pay for it through increased taxes.
Political reporter Morgan Reiner joins us now. Morgan, does this mean that I cannot have private insurance if I wanted to?
Well, everyone in California will have to pay into this system whether you want to or not. So yes, technically you could add more health care costs on top of that. But the assembly member who authored the bill, who I spoke to today, told me that you likely won't want to or need to. Democratic Assemblymember Ash Kalra first introduced AB 1400 last year.
Under CalCare, you would have comprehensive care even beyond what typical insurance covers, in the sense that it does have dental and vision, full pharmaceutical access without copays and deductibles. It also has long-term care.
It will be paid for through taxes on everyone, employees and employers alike.
Now, could there still be insurance companies for supplemental care or for things that aren't essential, discretionary items? Absolutely. And then for countries that do have single-payer health care, there are private plans that also operate. But the reality is that it wouldn't be needed.
Kalra said the state will be saving money.
Most studies estimate you can save at least 10%. That's tens of billions of dollars, by the way.
Republican Assemblyman Vince Fong is the vice chair of the Budget Committee. He said the costs don't add up.
Previous studies and analyses that have been done on government-run healthcare in California has estimates up to $400 billion a year. And just for context, the current budget proposal that the governor issued this week has our budget in California at $286 billion. So the cost of single-payer government-run healthcare is more than our entire state budget.
The California Medical Association is on board with requesting a cost analysis. The Nurses Association is ready to go for it.
We truly believe that healthcare is a human right and that everyone deserves healthcare. And it's time.
California is on a 2-year bill cycle. What does that mean? Well, because this bill was actually introduced last year, it has about 1 more month in order to make it through the House floor. If not, it dies. Now, if it does make it through, then it'll go over to the Senate. And if it passes the Senate, then it will end up on the governor's desk.
Hey, Maureen, there's so much confusion surrounding this, because then to add another layer, the governor mentioned something called universal health care as an idea that he proposed just on Monday. So how are these two different?
His will not get rid of private insurers, but will rather cover the health costs for all low-income people, regardless of their immigration status. It'll only apply to a few million people at most. Single-payer health care is just a more extreme version of his universal health care. It'll incorporate everyone in California.
Morgan Reiner reporting. Thanks, Morgan. A lot of people thought that the governor's proposal was very extreme. This proposal is from people who think he didn't go nearly far enough.
Right, and expensive at the same time, as you heard from some of those numbers there in that story.
Healthcare all over the place, right?
We'll see how this one works out.